Did you know that fewer than 500,000 people in the United States have scleroderma? Did you know? Do you even know what scleroderma is? Well, according to John Hopkins Scleroderma Center, scleroderma is an autoimmune, chronic, and uh, rheumatic disease that affects the body by hardening of the connective tissues. There are two types of scleroderma. Localized scleroderma, which affects only the skin tissues usually, and systematic scleroderma, which can affect the skin tissues, blood vessels, and even organs. Today I will go in depth on the cause, the types, the symptoms, and the treatments available for scleroderma patients. The two types of scleroderma are, as I said earlier, localized and systematic. Localized scleroderma usually affects the skin cells. Morphea is a type of scleroderma that usually occurs when patches of hard skin forms all over the body, even on the forehead or on their face. Linear scleroderma is also another type of localized scleroderma that can affect the body by forming patches either down the arms or the legs in a line. Another type of scleroderma is systematic scleroderma, which affects the tissues, the blood vessels, and even sometimes the organs, depending on where the scleroderma is affecting at. The cause of scleroderma is unknown. They do know, though, that overproduction and accumulation of collagen is what is seen in scleroderma patients. Genetics, according to some studies, genetics can also play a factor in scleroderma, as well as environmental factors and environmental toxins. Symptoms usually start with Raynaud phenomenon, which is basically the narrowing in the blood vessels in the hands, feet, and also in the nose and even the ear. The second symptom that usually occurs is hard patches that form either all over the body or either on a limb, down the limb of the arms or the legs. The third symptom that usually occurs is the not able to bend your joints and stiffening of the joints. And then usually in more severe cases, a buildup of collagen blockage can occur in major organs, or like the lungs or the intestines. Even though there's not a cure for scleroderma, there are treatments that can help individuals with scleroderma. People with linear scleroderma can try, or localized scleroderma can try physical therapy to help them regain their joint movements and help unstiffen their joints. There's also drugs that can help dilate blood vessels and keep them open. There's also special lotions and light treatments that can help individuals with their skin problems with scleroderma. Sometimes in more serious cases, local scleroderma can affect even the lungs, and they would have to either get a transplant or it can affect their immune system, and they would have to take drugs to suppress their immune system. In conclusion, scleroderma could affect a person very differently depending on how and where they have scleroderma. Causes are unknown and there is no cure, and it could affect anyone. Symptoms usually, depending on what type of scleroderma they have, like localized scleroderma, usually only affects their their tissue organs and their joints, while more serious case like systemic scleroderma can affect their organs and how they function as well. Hopefully y'all have all learned a little something about patients with scleroderma and how this can affect their daily lives. Thank you.